¿Cómo se siente? ¿Cómo se siente?
No me siento bien, tengo dolor aquí, acá.
¿Puedo caminar? ¿Puede?
Sí, pero no mucho, no por mucho rato.
¿Tiene alguna alergia a medicamentos?
Que yo sepa, no.
Kids. So then what we should do is do over on top of there. Yeah, these are all kids. 3 and bag 5 are all kids.
Do we have diabetic? We need an endo.
Hola, I'm Christine. I'm excited to be here in Guatemala. This is my 3rd UAH trip, and to be able to help those that aren't as fortunate as us, and be able to give them medical care that they can't get on their own. And so we're here to help them, teach them.
Hi, my name is Melissa Phipps.
And I'm Deborah Thorne. This trip is especially important for us because we're going to be sharing some knowledge with midwives or co-matronas in this country, and we're hoping to help treat and prevent postpartum hemorrhage.
Hi, my name is Jessica Bianculi, and I'm hoping to gain from this experience is exposure to different areas of medicine that I don't see very often because I work in a very subspecialized orthopedic practice.
This is amazing. I can't even put it into words.
Beautiful. Love it already.
PA student. What motivated me to come to Guatemala is I wanted to take a step out of my comfort zone because sometimes that's where the best things happen, and I also wanted to help provide access to care to people who don't have access, so I'm really excited.
I'm Angela.
JB, we're the power couple singers right here. I feel that you should always want to give back to the world, and I think when you can give back, you should, and it makes you not only just a better person, but it's just something that is what you should do.
Super important. I think sometimes we forget to stop and give back, and I think what motivated me was this guy, because he always makes me want to be a better person and be better and be a better version of myself. So thanks, honey.
What motivated me most was definitely the opportunity to help people in an underserved community. I love community work like this. The people here really need help, and it's nice that we get to come in and hopefully make a small difference.
Oh, really loved it, and I love to travel, and giving back really makes a difference in my life.
Hola!
Hola.
My name is Carrie. This is my third EYH. I decided to come here because I really enjoyed going to Belize last year and helping everyone, and I thought this would be a great experience to work on my Spanish and learn a new
passion for helping people in general, and we got this opportunity to come out here and work with in this remote area, communicate with people that really need help, and my heart's in it specifically because I have backgrounds in Central America, specifically El Salvador. So to me, it feels like we're neighbors, and why not help each other? So I have family backing me. I have my roots here, so for me, it's just like the perfect place. I couldn't think of another place more better than Guatemala.
We just had a patient come in. He was a 45-year-old male. He had a history of hypertension and diabetes. And he came in complaining of headache and nausea, actually. Wasn't really saying much about anything else, any other pain that he was having. And then we did his vital signs and noticed that he had a fever and he was tachycardic and a little bit hypotensive, which is some concerning vital signs. And also that his finger stick at that time was 274. So we brought him into a room to do an exam, and we found that he had a diabetic ulcer. He also had a right leg amputation from his diabetes in the past. So on exam we found that he had a left foot ulcer and also an abscess on the lateral aspect of his left foot. So given the situation, we decided that we should open the abscess because he was having a lot of pain over that area, and then obviously redress the ulcer and kind of go from there. So we did an incision and drainage, and then we cleaned the area, we cleaned the ulcer, we rewrapped the foot, and then we put the patient on some antibiotics, high-dose antibiotics, for the infection that he has there. We gave him some pain medication for the pain he will probably be having. And then we also had our diabetes educator come in and readjust his doses of his insulin because he was actually underdosing. He was taking a dose in the morning and at night when he really should be taking it multiple times, 3 times throughout the day. We gave him a glucometer since we had some extra supplies, and he used to check his blood sugar but does not anymore because he ran out. And then we suggested that he go to the hospital, but unfortunately the hospital is like a half hour away by
un carro or the bus. So he said that he can't go today, but he said he will go tomorrow. But it's just really scary because this is something, he's a diabetic and he has a large wound on his foot that's could be down to the bone, and he could easily have what happened on his right leg happen to his left, and it's just really scary that that could happen. So he promised us he would go to the hospital, so hopefully he will.
Mi nombre es Wagner, soy médico, tengo 27 años, soy guatemalteco. Actualmente estamos trabajando en esta comunidad que se llama Paquisico, que le pertenece a un municipio del departamento de Sololá. Esta comunidad, al igual que todas las comunidades del altiplano guatemalteco, tienen en su mayoría población indígena. Son comunidades pobres y en extrema pobreza, carentes de recursos hídricos, carentes de drenajes, carentes de servicios públicos, como la parte de salud, de educación. No se puede decir que no existen del todo, pero la verdad existen de una manera muy precaria. Las condiciones higiénicas que las personas mantienen acá hacen que se enfermen regularmente. Lo que se necesita es mayor atención primaria, mayor inversión en lo que corresponde a prevención. El hecho de hacer una jornada médica actualmente por lo menos viene a ayudar a la población, pero hay que tomar en consideración que solo es en este momento, que posiblemente dentro de 2, 3 o 3 semanas o un mes, la población necesite nuevamente estos servicios. Por lo tanto, si lo que se desea es un desarrollo sostenible, lo que se debe hacer es invertir específicamente en educación y en salud, y específicamente en salud, en educación y en salud, hablando de temas de prevención y de promoción de la salud, mejorando por lo menos el acceso a lo que tienen al acceso al agua, los drenajes, la disposición de excretas y en general la vivienda. La población es netamente indígena, la cultura cambia un tanto, los lazos familiares se mantienen y también regularmente esas relaciones filiales hacen que la misma población indígena viva con grandes familias. viven regularmente los padres, hijos con sus esposas y posiblemente los nietos. Eso produce demasiado hacinamiento y por las características que tiene este lugar, la topografía misma que tiene, el hecho de tener grandes extensiones de tierra es casi imposible, así que en pequeñas viviendas vive mucha población y eso crea sobre todo más problemas con la salud. Bueno, creo que solo me resta nada más agradecer la ayuda que pudieron brindar durante los últimos 3 días en estas comunidades. En realidad es bastante representativo. A veces solo se ve los datos cuantitativos que hablan sobre cuántos pacientes dimos, cuántos medicamentos dimos, pero en realidad no, sino que siempre nos olvidamos de los datos cualitativos, lo que corresponde a lo bien que se le puede hacer a la población con cosas como estas, que podrían parecer pequeñas, pero en realidad hacen bastantes cambios, sobre todo si se llevan a cabo de manera continua.
Bienvenidos a la campaña. Vamos a hablar lo que es un parto normal comparado con hemorragias durante un parto.
Apenas la placenta sale, es muy importante dar un masaje a la matriz. Es importante dar un masaje a la matriz para prevenir hemorragias.
¿Cuál es la segunda señal que ya la placenta?
Cuando el cordón se alarga.
Ella.
Que ya lo había dicho yo.
No lo digo, no lo digo yo.
Whether we're at clinic helping people or traveling around Guatemala, every moment has taken my breath away.
Colorful. Happiness. I love to see the smiles of everybody's faces and I love to smile back. Be adventurous because I'm stepping out of my comfort zone. I don't have a word because there is no word that describes how amazing this whole experience is.
Encanta is
return one day to help his people, and that touched my heart.
So lucky to be here and lucky to help others here. So it'd be very gratifying because I feel like we're able to help people, especially with that I'm seeing the parasites, and the kids are not able to eat as much and they have abdominal pain, so I feel like that's a quick fix, and I feel like for me that's been very gratifying.
The entire trip has been a really enlightening one. It's something that I don't think that I've seen thus far in the United States and didn't get on any of my rotations, and it's definitely
unexpected. I did not expect to see how much these people need help, and it makes me almost heartbroken that I can't do more for them, and it reassures the fact that I do want to become a PA and that I just want to keep doing this trip hopefully year after year, because this is so gratifying for me to get back.
Very, very grateful to be helping out here, and I'm impressed. I'm shocked.
So I got to see that for this experience.
So I have so many words I would like to use, but I think the word I'm picking is emotional. It is very emotional for me to see how much we are doing, how much we still could be doing, and it is emotional to see the change that is happening in my students.
Guatemala, an amazing place.